Needlestick injuries are wounds caused by needles that accidentally puncture the skin. Needlestick injuries are a hazard for people who work with hypodermic syringes and other needle equipment. These injuries can occur at any time when people use, disassemble, or dispose of needles. When not disposed of properly, needles can hide in linen or garbage and injure other workers who encounter them unexpectedly. These injuries can transmit infectious diseases, especially bloodborne viruses. Concern includes the human immunodeficiency virus, HIV, which leads to AIDS, acquired immune deficiency syndrome, hepatitis B, and hepatitis C. Incidental punctures by contaminated needles can inject hazardous fluids into the body through the skin. There is potential for injection of hazardous drugs, but contact with infectious fluids, especially blood, is by far the greatest concern. Even small amounts of infectious fluid can spread certain diseases effectively. The risk of infection after exposure to infected blood varies by bloodborne pathogen. It is estimated that after an injury in workplace situations from a needle contaminated with hepatitis B virus, there is a 6 to 30% chance that an exposed person will be infected. In a similar situation with HIV, there is about a 0.3% chance of infection, and there is about a 1.8% chance of infection for hepatitis C. Note also that because the hepatitis B virus may survive on environmental surfaces for more than a week, indirect exposure can occur via contaminated inanimate objects. Injuries have transmitted many other diseases, including viruses, bacteria, fungi, and other microorganisms to healthcare workers, laboratory researchers, and veterinarian staff. Many of these diseases were transmitted in rare, isolated events. They still demonstrate, however, that needlestick and sharps injuries can have serious consequences. Sharps is a medical term for devices with sharp points or edges that can puncture or cut skin. Injuries can occur at every stage of their use, disassembly, or disposal. A report from the Centers for Disease Control and Prevention, CDC, in the United States lists the following percentages for injury rates for injuries involving hollow bore needles. These are the top three. During or after disposal, 22%. In transit to disposal. In proper disposal. During disposal. After use, before disposal, 19%. Activation of safety feature. Recap needle. During cleanup. And during use, 52%. Access IV line. Transfer process specimens. Pass transfer equipment. Collision with a sharp or worker. Insertion or removal of needle. Equipment design, nature of the procedure, condition of work, staff experience, recapping, and disposal have all been mentioned as factors that influence these occurrences. Preventing injuries from sharps and needle sticks is considered part of the routine practices used by healthcare workers. Workers who use sharps require education and training as part of a sharps injury prevention program. Workers should be educated in how to protect themselves during use and to protect others who may encounter the device during or after procedures. The use of safety engineered devices such as protected needle devices or needle-free systems with self-sealing ports and syringes is encouraged. Using these devices must take into consideration both the safety and healthcare worker and the patient. Here are a few recommendations. Needles should not be recapped. Used items should be placed immediately in a designed puncture-resistant container that is easily accessible at the point of care. Healthcare workers should cover open skin areas or lesions on hands and arms with a dry dressing at all times. Hand hygiene is still essential, so consultation is necessary if the dressing interferes with this procedure. Eyes, nose, and mouth should be protected if splashes with blood or bodily fluids are anticipated. Immediately perform first aid if someone has been exposed to blood or bodily fluids. First aid should include thoroughly rinsing the injury site with running water, and gently cleaning with soap and water if possible. Flushing the eyes, nose, or mouth with running water if they have been exposed. Broken skin should be rinsed thoroughly. Report the incident and exposure immediately to your employer. Follow instructions for further treatment and follow-up from medical professionals when necessary. The hierarchy of control approach. Elimination. Find ways to eliminate or reduce needle use during procedures, medication delivery, and specimen collection. Engineering controls. Remove or isolate the hazard by using sharps disposal containers or other devices that have an integrated injury prevention feature. Safety devices must be chosen with care, as no one device or strategy will work in every situation. Work practice controls. Steps that can be taken to reduce injuries, including using instruments to grasp needles or load and unload scalpels, avoiding hand-to-hand passage of sharps, separating sharps from other waste, not carry garbage or linen bags close to the body, etc. Personal protective equipment, PPE. PPE should be used as the last control approach where appropriate. In situations where recapping is considered necessary, develop safe approaches which workers can follow. Workers should never move an exposed needle tip towards an unprotected hand. Recap by laying the cap on a flat surface and scoop it into the tip of a syringe held in one hand. Keep the free hand away from the sheath and well behind the exposed needle. In addition, all workers at risk should be aware that there is a vaccine available for hepatitis B. An effective system for disposing of used needles and sharps is crucial to preventing injuries. Have disposal containers readily available. Workers should place needles in wide-mouth, puncture-proof containers. Locate disposal containers specifically where needles and sharps are used to make safe disposal possible. Replace the containers before they are completely filled. Sharps containers should be removed and replaced when they are 3/4 full. Make sure they are sealed, collected, and disposed of in accordance with local regulations for biomedical waste. All staff should report every incident in which they find needles or sharps left at the bedside or thrown into the regular garbage. Remember, if you are stuck by any needle or sharps, report it immediately. Your treating doctor may recommend post-exposure prophylaxis. A decision to treat will depend upon where testing of the source of exposure is possible, whether the source tests positive to HBV or HIV, whether there has been exposure to blood from that source. Where the exposure source is unknown or can't be tested, an assessment of the situation may suggest an increased risk. For example, a needle discarded from a drug treatment facility. This may involve treatments with specific medications that may prevent development of infection. You should be referred to an infectious diseases specialist for this treatment. You can work with needles safely, reducing the risk of needle stick injuries. Just remember the following. Health workers who may come in contact with blood or bodily fluids should receive hepatitis B vaccinations. Follow all safety procedures in the workplace. Regularly undertake safety refresher courses. Minimize your use of needles. Remember that latex gloves don't protect you against needle stick injuries. Don't bend or snap used needles. Never recap a used needle. Place used needles in a clearly labeled and puncture-proof sharps-approved container. Thank you for taking the time to educate yourself and help keep everyone around you accident-free. If you ever have any questions, don't hesitate to reach out to management. Thanks for watching and have a safe day.